So let's start off introductions. So Jack, you're the president of TransactRx. So tell us about you. How did you get started in the pharmacy industry?
So back in 1992, way back when, I was an early e-prescribing guy. So I had owned and operated technology companies since the 80s. In 1992, a partner said, I have the next big thing. And it wasn't called e-prescribing then. He owned a pharmacy, so we need to get the doctors connected. So we actually started up an e-prescribing company in 1992, way before SureScripts, before RxHub. And we ended up selling that company to a pharmacy that was growing. We took that public and we turned that into a chain of 25 pharmacies around the state of Florida that were all connected, all using e-prescribing from around 2,000 physicians around the state of Florida into this chain. We opened a mail order facility that was doing about 2,000 fills a day out to the patients. And we added on a home infusion company because there was, we were not busy enough, and started a PBM. And so back in the 90s, this is what I did. And then that company started buying up other transaction companies. That was called Proxymed at the time. It was a public company. And we became the second largest healthcare transaction company behind what was called Emdion at the time. And I've stayed involved in the transaction space and in and around the pharmacy part of this since then. So it's been a few years.
So that became Emdion? That technology rolled into Emdion?
No, we competed with Emdion back at the time. Although much later, Change Healthcare did buy that company. Oh. And so now it is actually rolled into and part of the platform still being used by Change Healthcare on the medical claims clearinghouse side. We sold the e-prescribing part of the company to SureScripts after SureScripts came into being a few years after that. And that company is no longer around.
Okay.
Cool.
Wow.
So how did that take you into the medical billing? No,
right. How did that transition into
TransactRx?
Oh, so then after I left that company, I was doing consulting for a while, and I was working with a private equity group that was investing in a company that was one of the largest drug repackagers in the country. Had a physician dispensing part of the business, which was the smaller part of the repackaging, but one of the larger ones, which is where Andrea comes into the picture because she was working with them. That was called Dispensing Solutions, Inc. And then they decided to spin out the technology part of that drug repackager, which started as the physician dispensing system, which there were a few thousand physician offices doing dispensing on this system back then, and doing full ordering, getting all their drugs from this repackager. And then Part D came into being. They decided to move Part D vaccines to the Medicare to move vaccines to Part D. And Andrea was working with that physician dispensing company and her husband. And Andrea had the idea of helping these pharma companies. It was Merck. They came out with Zostavax, and they couldn't sell it to the physicians because they didn't have a way to bill for it. And so decided to add in the physician to pharmacy billing into that company. And then when we built the platform out, we built it to go both ways, helping physicians get paid for pharmacy benefits, pharmacies to get paid for medical benefits. And so that was in 2008. In 2010, when retail pharmacies started to be able in general to provide administer vaccines to patients around the country for flu shots, that's when we started in earnest using the pharmacy to medical benefits part of our transaction platform.